Hi friends, this is Parvati from OPRA. Welcome to my channel. I need your support, so please subscribe, share and like my videos. Also, you can mention your valuable comments in the comment box. I have some voice tone problem. If any inconvenience in between this video, please cooperate with me. Extremely sorry for that. We can continue our the video, okay? Today we are discussing here the Adrenergic Antagonists Part 2, imidazole and alpha blockers. This classification I just mentioned for the easiness of our study. In this section, mainly two drugs we are discussing here, phentolamine and talazoline. Phentolamine, these two drugs, it's coming under non-selective alpha adrenergic receptor blocker. From this section, we can understand the mechanism of action. It's mainly block the alpha-1 receptors and also it blocks the alpha-2 receptors. So, the first one is it blocks the alpha-1 receptors. It leads to vasodilation, arterial and venous vasodilation, and then it lowers the blood pressure. Because of this, it can cause the postural hypotension and reflex tachycardia. These are the main adverse effects coming under this one. Okay. The next one is it blocks the presynaptic alpha-2 receptors. That means it increases the norepinephrine release, so which can lead to stimulating the beta-1 receptors and it's potentially causing tachycardia. Tachycardia, everybody know, that means increases the heart rate. In the next section, the other effects coming under the mechanism of action, it can stimulate the histamine, H1 or H2 receptors and also muscarinic receptors. So it's leading to bronchospasm, increased gastric acid secretion and gastrointestinal motility. The main therapeutic uses for the phentolamine are, the first one is treating phenochromatocytoma. We know the preferred drug for phenochromatocytoma is phenoxybenzaimine, one of the important use for the phenoxybenzaimine. But the phentolamine also we can use the treating the cases for phenochromatocytoma. Okay. The next one of the important uses for the phentolamine is hypertensive emergencies. What are the cases are clonidine withdrawal and cheese reaction. Cheese reaction we know the MAVO inhibitor related crisis and also the hypertensive emergencies cases like tissue damage from norepinephrine extravasation. These are very important uses for the phentolamine. And the another important use for the phentolamine is used in the Raynaud's disease and frostbite. These are very, very important points. We can expect the questions based on this one. We want to thorough it. And this, what are the points I mentioned in this notes? It's very condensed form. We want to study it each and every point very thoroughly. We can expect questions from any section. Okay. And the next one, adverse effect for phentolamine. One of the important adverse effect for phentolamine, it causes the postural hypotension, tachycardia and arrhythmias. We already discussed in the mechanism of section, the same one. Okay. The next one is gastrointestinal symptoms like hyperacidity and diarrhea. The next one is nasal congestion, failure of ejaculation and bronchospasm. These are the main adverse effect for phentolamine. The next one is contraindications. We know it causes the hypertension. Contraindicated in the cases of hypertension, bronchial asthma, peptic ulcers, and it's also in the coronary artery diseases and conditions worsened by tachycardia. Okay. The next highlighted point I mentioned here, for the treatment for phenochromatocytoma, we can use the phenoxybenzaimine. For the diagnosis for the phenochromatocytoma, mainly used one is phentolamine. We can expect the questions based on this. Because of that, I highlighted these points. And the next drug is talazoline. The mechanism of action of talazoline, we know it's a non-selective alpha adrenergic antagonist. So it blocks the alpha-1 and alpha-2 receptors. Okay. Therapeutic uses for the talazoline main uses are peripheral vascular disease. In this case, we can use this drug, mainly the Raynaud's disease and also atherosclerosis. Okay. The next one is persistent pulmonary hypertension of the newborn. That means it's used to reduce the pulmonary vascular resistance in newborns with this condition. This condition means mainly it's characterized by high blood pressure in the lungs of the newborn. So in this case, one of the important drug is talazoline. The next one is adverse effects of telazoline. Same as like phentermine. Main adverse effects are hypertension, tachycardia, and also the gastrointestinal disturbances. Okay, the important note I mentioned here, it's very confusing drug with these drugs. Because of that I highlighted this point. Tetrahydrozoline, silomethazolin, oxymethazolin, and nafazoline, these drugs are mainly coming under alpha 1 agonist, and it's mainly used for the nasal used as nasal decongestants. Everybody know this one. These drugs are very familiar. And the tolazoline, it's a alpha blocker, so we can expect the questions. Mainly these drugs we can expect in the option section. Okay, very confusing option. Because of that I highlighted. Please thorough with this point. And the next one is next section, selective alpha 1 blockers. Okay, in this section mainly discussing the drugs are prazosin, terazosin, doxazosin, tamsulosin, and alfuzosin. One of the important drug in the selective alpha 1 blocker is prazosin. The main important pharmacologic actions of the prazosin are decreased blood pressure. That means we know it selectively blocks the alpha 1 receptors, mainly in the blood vessels. So the prazosin causes the vasodilation. So it's reducing the peripheral resistance and lowering the BP. Okay. The next important pharmacological action is it increases the increased urination. So it relaxes the smooth muscles in the bladder, neck, and sphincter, and it helps to improve the urinary flow. And it's mainly used in the conditions like benign prostate hyperplasia. Okay, and the next one is it's causing only the minimal adverse effect. The main reason, it avoids the alpha 2 blocking effects because it's a selective alpha 1 receptor blocker. So it leads to reduced side effects like tachycardia and excessive norepinephrine release compared with the non-selective alpha blocker phentermine and tolazoline. One of the advantage for the prazosin, it avoids the alpha 2 blocking effects because it's a selective alpha 1 blocker. So from this one we can understand the mechanism of action. It's a selective alpha 1 blocker. And the next point we are discussing here, the therapeutic uses of prazosin. Prazosin, the main uses are, it's used in the essential hypertension because it's a selective alpha 1 blocker. So we can use these drugs. It's a combination with diuretic for a long-term management. The next one is it's used in the congestive heart failure cases. It helps by reducing the both preload and afterload. That means the venodilation and arteriodilation. So it's enhancing the cardiac output also. And it's also used in the peripheral vascular diseases, PVD, mainly the Raynaud's disease. The next use is secondary hypertension, specifically in the cases caused by phenochromatocytoma. In this case, we can use the prazosin, and it's also one of the important drug choice for the benign prostate hyperplasia. But we know the main preferred drug for the cases for benign prostate hyperplasia is tamsulosin, and it's also the primarily choice. The other drug is alfuzosin, but the main preferred choice is tamsulosin. Okay. Very important therapeutic uses. We want to thoroughly study these points. We can expect the questions based on this one. Okay. And the next use we are discussing here, rebound hypertension. One of the important use for the prazosin is rebound hypertension. We know the abrupt withdrawal of clonidine causes rebound hypertension, one of the important side adverse effect for clonidine. In this case, we can use the prazosin. We can use the prazosin for the treatment of rebound hypertension caused by the withdrawal of clonidine. Okay, a very important point. Okay, the other one is hypertensive crisis in the cases of cheese reaction, mainly seen in the MAVO inhibitor treated patients. One of the other important use for prazosin. The last one is vasoconstriction for severe cases like extravasation of norepinephrine. Okay, these are the main important uses for the prazosin. Very important uses. We want to thoroughly study these points. We can expect questions based on this one. And the one of the other important section in this prazosin is adverse effect. The main important adverse effect for prazosin is the first one, and the important one is first dose phenomenon. First dose phenomenon, that is mainly the severe postal hypertension due to potent venodilation, especially with the initial dose for prazosin. So the preventive measure for this case is we can start the prazosin treatment with a small dose at bedtime and gradually increase the dose. This is the preventive measure in this case. Very important point. We can expect the question based on this one. What the other important adverse effects are nasal congestion. Mainly it's caused by dilation of nasal blood vessels, and it also causes the failure of ejaculation due to its effects on smooth muscle function, and it also causes the sodium and water retention, results from reduced renal blood flow, but it can be managed by adding a diuretic. Okay, these are the important adverse effects for the prazosin. Okay, the other drugs we already discussed, mentioned in the introduction section for the selective alpha 1 blocker, terazosin, doxazosin, tamsulosin and alfuzosin also coming under this section, but we don't want to thoroughly study these drugs. We want to just know about what are the important coming under the sections. Okay, terazosin is a selective alpha 1 blocker and it's used for the hypertension and BPH. It can also cause the postal hypertension because it's selective alpha 1 blocker. And doxazosin, it's a long-acting alpha 1 blocker for hypertension and BPH. It's also linked to first dose phenomenon. We already discussed in this one, this point in prazosin. Okay, tamsulosin alpha 1 selective blocker, and it's also preferred drug for the treatment of BPH. Everybody know this point, one of the important use for tamsulosin, and it's also associated with the floppy iris syndrome. It's an adverse effect of tamsulosin. I mentioned below what is the floppy iris syndrome. We can just read it. Just for understanding, I mentioned that point. Okay, but the highlighted point, tamsulosin is associated with floppy iris syndrome. Okay, we can expect question based on that. And the next drug is alfuzosin. Alfuzosin, it's a selective alpha 1 blocker, and mainly it's primarily used for the treatment of BPH. Okay, and fewer cardiovascular side effects only showing this drug. And the next drug, last I mentioned here, yohimbine. It's a selective competitive alpha 2 blocker. The important point for this drug, it's mainly used as a sexual stimulant. Okay, and it's also used for the treatment of erectile dysfunction. This is one of the important point for and uses for the yohimbine. Okay, the next point I mentioned, just read it and understand it. Yohimbine, it increases the sympathetic outflow to the periphery, and it's leading to heightened the cardiovascular activity and exacerbated the psychiatric conditions and impaired renal function. Therefore, it is contraindicated in patients with these conditions, mainly in the psychiatric conditions and also cardiovascular problem patients. Okay, these are the important drugs we are discussing in the non-selective alpha blockers, selective alpha blockers, and competitive alpha 2 blocker. Okay, these are very important drug, very condensed form. We want to thorough with these points. We can expect the questions based on this. Today I am just wind up here. I need your support, so please subscribe, share and like my videos. Okay, thank you.